lift this up for it? Thank you. And just look up and down. Inhale and exhale. You're doing great. Okay. Just a little bit lower on the bottom of your back now. Hello. Please just take a seat over there. Thank you. Could I just start by double checking your name and your information? So your name is... This is the appointment. So it is basically just a routine checkup today? Good. No, that is absolutely fine. That's what it says in here as well. Good. So, you haven't had any issues lately? No? Did you experience any change? Like feeling exhausted, under pressure, stressed? Any visible changes? And what about your sleep? Okay. How long did you have those issues now that you're struggling falling asleep? Okay. But it's also sleeping through, right? It's not just falling asleep. Okay. So, I'm going to examine you today, but about the sleeping issues, it could be that I have to book you a following up appointment. It would be relatively soon, could be by the end of the week actually. Good. But let's see what we find today first, right? Good. So, there are no prescriptions listed here that you're currently taking? Yeah, we will have a look about that sleeping issue. There are different ways. It doesn't always have to come down to sleeping pills, but we will definitely keep it in the back of our mind and see what is the best treatment for you. Do you know roughly when that issue started? Hasn't changed since then? Okay. I can see here that you had your last routine checkup roughly half a year ago. That is fine, no worries. And the sleeping issue is the only problem that has occurred since then, yeah? Okay. I know you're already familiar with the routine checkup procedure, but let me just list the few steps we're going through today. Yeah, so the first step we already had. I am asking you a few questions about your medical past, if you experience any issues, how you currently feel, if you feel healthy. Now, it's definitely important to also feel healthy, not just physically, but being happy with your body, with your physical health, feeling full of energy. Good. So, in a few minutes, I will put my gloves on and I am going to check different spots. Yeah. Now, it's a very gentle touch. You can close your eyes if you want. I'm just making sure there are no lumps, bumps, anything out of order. And just gently checking your scalp area, your face, your neck, and also the back. After this, I am actually going to introduce you to a very new way to take blood pressure. I have to take your temperature, even though you're saying that you're fine. And I will listen to your heart, double check that everything is alright there. And at the end of the exam, I'm also going to double check your eyes and your ears. Just doing a few very small tests, nothing to worry about. Are you alright with that? Do you have any questions about that procedure? Should take something between 20 and 40 minutes. Good. So if you don't mind, just stay comfortable over there. I just prepare everything we need, and then we can start in a few minutes. Thank you. Good. Do you feel ready to start the examination? Alright. So I will start by gently touching different areas in your face. Please just tell me if you experience any kind of slight discomfort or even pain. Okay. Just checking here around your eyes. Okay. And on the side. Just lift this up for it. Thank you. The reason why I take a closer look at you is also just in case to see any deformity, any slight difference, any swelling, for example. Sometimes it's actually quite visible to the eye, but you look actually perfect. Nothing to worry. Good. Just very gently touching this area. No pain? Okay, good. Just double checking here. Okay. Right. And on the top of your scalp. Okay. Okay. Same procedure over here. Looks good. And if you would just okay. All right. Okay. Does all look very good and healthy. Okay. I'm just going to note this down. Good. So the next step of the examination would be that I do take your temperature. I know you're feeling well, but it is just to get the most accurate data, how you feel, and keep track of everything. Okay. So you know how this works, nothing special here. So if you would just be so kind, open your mouth. And there we go. Thank you. Just hold it there for a few minutes. Shouldn't take too long. Just try to keep this closed. See what it says? Almost. Good. All right. Wonderful. Okay. So the next thing we're going to do is we're going to take your blood pressure. So the thing about our praxis is that we're actually one of the very lucky, very few ones that got a new medical device to do so. Yeah, it's not the old one anymore, but it's so much easier, also for the patient. So I'm going to use this. And are you left or right-handed? Okay. Then I am going to take this out, prepare a section on your arm by cleaning it with the alcohol-free wipe, and I will use a specific little liquid that then gets applied, and then the new medical device basically gets snapped around it. But I show you that in a second. Okay. Okay. Are you ready? Okay. Just cleaning that section. That looks good already. Perfect. That was already that. Okay. So this little thing here is the liquid. I'm now going to gently apply on your arm. It might feel a little bit cold, but that's all that's about to happen. Okay. Okay. Are you ready? So now to the next step. This is the brand new device. It just looks like a bracelet, doesn't it? So, as you can see, it does react to contact. And we are just going to take this and snap it around your arm on the prepared spot. And it's going to test on several different things, but mainly your blood pressure. Just hold still. Yeah, thank you. Just gonna put this around. Okay, that should be it. Okay, so I activated it now. And now you just have to sit still for a few seconds. I think you should be able to feel that it tightens up a bit now. Don't worry, it's not getting any tighter than this. This is already the maximum amount. It is almost done scanning. Perfect. That was already it. Okay. Just putting your information into the tablet. Okay. Everything is alright. If you're interested in your details, I'm happy to provide them and send them to you to your email address. It is basically an explained version for the patient, so it's not just a bunch of confusing numbers. No, we think it's actually very important to explain and show everything to our patients. It is good to trust your doctor, yes, but on the other hand, it is even better if you understand why we're doing certain procedures, what this number means, or why this and that number might actually be an indicator that there is a change in lifestyle required, or some medication. Okay. Perfect. If you're okay with that, I would like to listen to your heart now. So yeah, if you just slightly take, yeah, thank you. So this might feel a little bit cold on your skin, and what's about to happen is I'm going to put this on and going to put this on little different areas on your chest, also on your back, so I can get a good idea and good sound of your heart rate, if everything sounds healthy. So how this works is, when it is on your chest, I'm going to ask you to take a deep breath in and then exhale again. Okay? So you just follow my instructions. When I say inhale, I want you to take a deep, relaxed breath. And when I say exhale, you just breathe out. Yeah, we're going to repeat that a couple of times, different areas. Good. I am going to start on your front area. Good. Inhale. And exhale. Inhale and exhale. Okay. Inhale and exhale. Good. Inhale and exhale. Good. Inhale and exhale. Wonderful. Just going around you, just over here. Okay. Inhale and exhale. Good. Inhale and exhale. You're doing great. Okay. Just a little bit lower on the bottom of your back now. Inhale and exhale. Good. Just double checking. Inhale and exhale. Perfect. Inhale and exhale. Good. Perfect. Thank you. I'm just putting your information to the tablet again. Oh, I can show you that. No worries. Okay. Didn't know you're interested in that. So I give you that. Just put it into your ears. And then, yeah, good. So, just. Right. We take this. Just put it on the chest. Do it on you as well. It's very interesting, isn't it? Okay. Good. So now that this is all sorted, we just have 2 tests left, which is the eye exam and a little hearing test for you. Exactly. So what is about to happen is I am going to use a little light, and I want you to choose a point behind me on the wall. Just stay fixated on it. So I'm going to take that light and move it around different areas and seeing how your pupils react to it. And after this is done, I will ask you at some point to stay fixated on the little light, actually, and just follow it around wherever it moves. Are you ready? Okay. You found your spot? Just checking. Mm-hmm. Check. Just gently going to pull down. Just ever so slightly. Okay. Mm-hmm. And on the other side. Good. Okay. Mm-hmm. Okay. Are you getting sleepy? Unfortunately, you can't close your eyes. I'm sorry. Good, I just gently asked you to stay fixated on the light now. Just follow it with your eyes, and your eyes only, wherever it moves. Good. You're doing great. Just keep following the light. And just look up and down. And just look to the side. And down again. And to the other side. Just follow the light up and down. Perfect. Very well. Good. Okay. So the last test is going to be a very simplified version of a hearing test. I am going to whisper a few trigger words, and I just want you to tell me if you did hear them, what I said. Maybe I'm going to trick you and put some gibberish into it. Just a test. It's not going to be too difficult, I hope. Are you ready? Okay. So I'm just walking from ear to ear. Are you alright with that? Good. Let's start then. We are just going to start on this side. A-S-M-R. Did you hear what I just said? Good. Well done. I am now going to start with the second sentence. Ich mag Lakritz. Did Did you hear what I just said? You are right, that was a different language. Very well done. Okay, then I'm now going to say the next word. Doctor's office. That was correct. Kindness. ASMR. Latex gloves. You did very well. That was already the end of our little routine exam, and everything looks very good. I haven't found anything you have to particularly worry about, but I did note down that you have issues falling asleep and sleeping through. There is another office, another doctor's office, we work together with very closely. So they are specialized on sleeping problems, everything that has to do with that exactly. They offer different treatment versions, everything from hypnosis, sleeping pills. Honestly, they find the right treatment for every problem, and not every sleeping difficulty case is the same, so I wouldn't worry. I'm pretty sure they can help you. Should I book a follow-up appointment there then? Good. Okay, so I just put you into their system and requested a consultation with one of their experts. You should get an email in the next couple of days, and they're going to tell you exactly when the appointment is happening. Good. Thank you very much. It was a pleasure to be a doctor today, and I do wish you all the best for your sleeping issues. Okay. Thank you very much.